Let's talk about some of the Saudi Council Prometric exam for nurses. A 5-year-old child is seen in the primary clinic with mild fever, headache, malaise for about 2 days and today he has rash filled with fluids. Which of the following is the best suggested diagnosis? So rash filled with the fluids plus fever, headache and malaise is chickenpox. Patients with measles, rubella is on airborne precaution. Which of the following precaution techniques would be essential to implement for non-immune persons entering the room? Answer is mask. A home health nurse has entered a home to complete an admission assessment on a patient who has methicillin-resistant Staphylococcus aureus MRSA urinary tract infection. The patient will receive intravenous antibiotic via peripherally inserted central catheter PICC for 3 weeks. Which of the following action should the nurse take first? Shake the patient's hand, place the nursing supply bag on a clean dry surface, obtain the patient's written consent for home health care, perform hand hygiene. So the correct answer is perform hand hygiene. You have just admitted a patient with bacterial meningitis to the medical surgical unit. The patient complains of severe headache with photophobia and has a temperature of 102.6 degree Fahrenheit orally. Which type of isolation should be suitable for the patient? So bacterial meningitis is droplet isolation. Patient with colostomy complains of itchiness of the peristomal skin. On assessment, the skin got red rash with white patches. What is most likely the cause of this condition? Not changing the pouch regularly, candidiasis, consuming acid-producing foods, or dehydration. The correct answer is candidiasis. A 33-year-old woman has come to the outpatient clinic for treatment of a vaginal infection. Physical assessment reveals yellowish, excessive, thin, offensive, and frothy discharge. Which of the following is the most likely diagnosis? Candidiasis, trichomonasis, bacterial vaginosis, and chlamydia. So the correct answer is trichomonasis. A 5-year-old child is seen in the primary care clinic with headache, malaise for about 2 days, and today he has rash filled with the fluids. So we told about this one. This is chickenpox, right? Chickenpox. How long the child should be isolated after formation of fluid-filled rash? Answer, 6 days. A toddler is seen in the emergency room with a history of high temperature for 5 days. He had watery eyes and cough for 3 days. Then he developed rash all over the body, which started on his face and spread down to his body. The mother did not remember the vaccination schedule. How long this child should be isolated? Answer is 10 days. Which case is this? Measles. The nurse is assessing a 65-year-old patient who reports fatigue, weight loss, night sweat, and productive cough with thick sputum. The nurse should immediately initiate isolation precaution for which of the following? Answer is pulmonary tuberculosis. So C, fatigue, weight loss, night sweat, evening rise of temperature, and productive cough. That is pulmonary tuberculosis. A patient presented with high fever, headache, vomiting, and neck stiffness for past 3 days. Which of the following is the first diagnostic intervention for this patient? Answer, lumbar puncture with CSF aspiration. Why? Because he has neck stiffness and vomiting, right? Okay, thank you and see you in the next session.